Hi, it's Cindy recording part 2 of the Chapter 7 Handbook Exercises review. I remembered after I closed part 1 that I did not go over the guideline that would be applicable in the case of acute and chronic cervicitis. Each unique ICD10CM code may be reported once for an encounter. So this applies to bilateral conditions when there are not distinct codes identifying laterality, or two different conditions, which is true in this case of acute and chronic cervicitis, two different conditions classified to the same ICD10CM diagnosis code. So in other words, you only report it once. And that's coding guideline 1B12. All right, so now we'll go to the next one. And this is brain damage following cerebral abscess 7 months ago. Exercise 7.7, number 3. Looking at our pathway, damage is our main term, brain our subterm, and it is non-traumatic because it's an abscess, it's an illness. It's not an accident or brain injury in the sense of someone being hit in the head or sustaining a head injury during an accident. So G939 is our code for the brain damage, and then for the abscess, we're going to actually look up sequela. So let's move to our document camera, and here's damage, brain, non-traumatic, G939. So if we turn to G939, it's a very general code. G939, disorders of the brain unspecified. As unspecific as that diagnosis or that description is, it's the best you're going to do in this category. So G939 is correct for brain damage. It's the sequela of the abscess that's most important to us. So we're going to go back and look up sequela. Oh, it's the very first one. I'm making this too hard. Okay. Sequela of abscess. G09. What's interesting about this, and if I had the author of the textbook with us, I would be asking her this question, because it looks like abscess, intracranial or intraspinal conditions in G06, the sequela of those would be G09. Now it may be that these are not exclusive. There could be other sequela, because our code was not G06. Okay, so just a case in point. Sometimes you do wonder how the author got the answers that she got, and that's okay to question. I can tell you when I give you an exam or an exercise, I will be able to defend to you why I chose the answers I chose, and that's what I want you to be able to do as a coder. Be able to defend why you selected a certain code. So here's our sequela code, G09. Let's go back in the tabular to G09. Sequela of inflammatory diseases of the central nervous system. And since the brain is considered to be part of the central nervous system, this is the right code. Again, here is the same situation where I would be questioning this author, because it says G09 is to be used to indicate conditions whose primary classification is to G00 through G08 as the cause, themselves classifiable elsewhere. The sequela include conditions specified as residual. So this part I still question a little bit, but this part we have right. Code the first condition resulting from the sequela of the inflammatory diseases. So the first condition we coded was the brain damage, and then here's our sequela code. So that might be something I will look through the coding clinics to see if I see any clarification on that. But that's an example of where a coder might read something, have a medical record that he or she is coding, and send an email to the coding clinic and ask for clarification. That's a good example. Okay, now I want to talk about which guideline is applicable in this case. And this is the one I chose. The coding of the sequela generally requires two codes sequenced in the following order. The condition or nature of the sequela is conditioned first, and the sequela code is sequenced second, which is what we did here. Our next exercise is 7.7 number 12, borderline hypothyroidism. And if we look up hypothyroidism in our index, it is E03.9. So let's go there to our index, and you can see here's your hypothyroidism. And we're looking to see if there is a classification for borderline hypothyroidism. And there is not. So this is, it doesn't seem to be our code. So we're going to go back here, and it is just hypothyroidism unspecified. This mixed edema is a word that you occasionally see in the medical record documentation, so just be aware of that word. While I'm thinking of it, if you're ever looking for a word or you run across a word in the medical terms that you don't find that word, if you go into mixed edema, put a colon and mixed edema, swelling of the skin and underlying tissues, giving a waxy consistency typical of patients with underactive thyroid glands. So mixed edema is more of a condition because of hypothyroidism. But just think of this sometimes when you're looking up a quick medical term, if you just go into your Google search engine, type in your word, put a colon after the word and search, you get your definition. And if you want to hear its pronouncement,
mixed edema,
you just hit this little phone.
Mixed edema.
Isn't that neat? I use this tool probably at least once a day, looking up a word or it's usually medical terms, because the medical literature is always growing, and no matter how much you know, new terms are coming on the horizon, as well as new medications, new chemicals being used in different chemotherapies. So it's just a good idea to use this as a search engine tool. All right, just wanted to show you that. So back to borderline hypothyroidism. Here is the guideline for that. If the provider documents a borderline diagnosis at the time of discharge, the diagnosis is coded as confirmed, and this would be inpatient, obviously, unless the classification provides a specific entry. And we'll go over that in just a few minutes. Borderline diabetes, there is a code for borderline diabetes. And this particular guideline is coding guideline 1B17. And here's that borderline diabetes that we were mentioning. It is code 73.09, but in the alphabetical index, it's borderline. Under that is diabetes. Under that is R7309. So if we go to the alphabetical index, our main term is borderline. And here's diabetes, R7309. Someone brought to my attention, a professional coder brought to my attention, that using the main term borderline, there are 5 conditions. So it's probably a good idea, if you're going to be coding for a living, that when you would see the term borderline in the literature, that you would know that it's only these 5 conditions that there's a unique code for borderline. Otherwise, that coding guideline applies where borderline is not even considered in your diagnosis. You would just go to the main term. So here we go, R7309. Let me go back in the tabular and look up R7309. You see it right here. So, oops, no, that's not right. R7309. Here we go. R73.09, other abnormal glucose. Prediabetes is one of those terms. So this is how borderline diabetes, it's not an E code, which many of the diabetes codes are. It's rather an abnormal lab, an abnormal symptom code. In this case, abnormal glucose. And back to our guideline. It's the same guideline we used in the previous exercise, but this one is related directly to the borderline diabetes. If the provider documents a borderline diagnosis at the time of discharge, the diagnosis is coded as confirmed unless the classification provides a specific entry. For example, borderline diabetes. Now I'm going to go through a couple of exercises that are not in your coding handbook because I think they're good practice for reading a little bit more than one line and asking the questions that you have to ask to know how to code diagnoses. In this scenario, a 60-year-old female patient has a shortened right leg tibia that is of unequal length compared to her left leg. The deformity of her right lower extremity is a result of the fact that she had acute poliomyelitis when she was 3 years old. So what is the residual condition in this case? The residual condition is the deformity of the right tibia that is an unequal length compared to the left tibia. And the deformity is the result of the sequela. The deformity is the result or the sequela of the past polio that she had as a child. So that past polio infection would be coded as a sequela. So in our pathway, we begin with the main term deformity, next term limb, acquired. In other words, it was not something she was born with. If she had been born with that shortened length, that would be congenital. Acquired, unequal length, short site is the tibia. Takes us to code M21.76 dash, that dash meaning we need an additional character. So first let's start with our alphabetic index. We start with deformity and we go down until we get to limb. Here's limb. Go over another indentation and we're looking for unequal length. Here we go, unequal length. Short site is, we know from our literature, it is the tibia. And here's the tibia, M2176 dash. Both the dash and this little black box with the white check mark mean additional character or characters are needed. So we then go to our tabular. Unequal limb length, acquired, tibia, and fibula. You notice that this category code right here is for the tibia and the fibula. But we also notice that a sixth character is needed. 5 characters are given. A 6th character is needed. So we're going to read through these sub-terms and codes until we get to what we want. And in this case, the first one is what we want. It's her right tibia. So our full code is M21.761. The next thing we have to look for is the sequela of the polio. So that is going to be the main term sequela, subterm poliomyelitis, B91. So let's go to our alphabetical index. And here we are under sequela. We're going to go all the way to the P's. Poliomyelitis, B91. So now you're going to go back in your tabular to B91, and it's a very simple, in this case, code, sequela of poliomyelitis. So B91 is the correct code in this situation. I want to bring to your attention here, though, this little excludes one note. If you remember, exclude one means you cannot use the B91 code and the post-polio code. It's there. Excludes one. You cannot use both the B91 and the G14 code. So you would have to examine your literature and be sure that you're coding the right thing. If your doctor has documented post-polio syndrome, that is a different diagnosis than sequela of poliomyelitis. So just kind of be aware of that. So back to our problem here. We have added our 6th character of 1, so because we're talking about this patient's right tibia, and we have our sequela code from B91. And which coding guideline helped me with that? Coding guideline 1B10, which is just as simple as the coding of a sequela generally requires 2 codes. The first code is the condition or the nature of the sequela, which in our case was this shortened leg length on the right tibia. And the sequela code, B91, is the second code. So your guideline gives you sequence and advice, not advice, a rule, sequencing rule, and tells you which goes first. Okay, here's another exercise not in your coding handbook that I just want to talk about because it is important and it helps you to know that for the most part, 99.9% of the time, you're only going to use physician documentation when you're coding. But there's a few situations where you are allowed to use the documentation from other providers of care because their documentation is more specific. And this is the case that I've chosen to illustrate this. The physician is saying the 36-year-old female is admitted for bariatric surgery with a right heel ulcer. Her admitting diagnosis is severe obesity due to excess calories and a right foot ulcer. If you only had that information to go by, you could not gauge the depth or the stage of that right heel ulcer, which is important in the situation of ulcers for many reasons, not the least of which are present on admission, which we will talk about as you become more familiar with coding in the hospitals. But the hospitals have to report what a patient comes in with, what stage of an ulcer, for example, they come in with. And if that ulcer gets worse, Medicare is not going to pay for something that happens in a hospital that the patient didn't come in with. So in this case, the staging of an ulcer is very important. It's also a more complete documented record when the patient's BMI, body mass index, has been documented, and the dietitian, as a normal part of his or her role, is going to document the patient's BMI on his or her report, and the nurses are going to document what stage a pressure ulcer is. So we know from the guidelines that we can use this documentation, dietitian's documentation for the BMI and the nursing documentation for the stage of the ulcer. And here's the full guideline that helps us know that. Is coding guideline 1B14 for the body mass index, or BMI, the depth of non-pressure ulcers, this should be non, not mon, non-pressure ulcers, and pressure ulcers. Code assignment may be based on medical record documentation from clinicians who are not the patient's provider, since this information is typically provided by other clinicians. And as I mentioned earlier, the dietitian often documents the BMI, the nurses often document pressure ulcer stages. However, the associated diagnoses with these conditions, such as a patient's being overweight, obese, or having a pressure ulcer, must be documented by the provider. So yes, you're going to be able to dig deeper in these specific cases, but you don't get your diagnosis from those cases. So here's our final codes, and I just wanted to go through these with you. Obesity, severe. Okay, we're going to go to the alphabetical index. Here's obesity. We can go down to severe, and it's E66.01. Notice also morbid, E66.01. Those words are sometimes used interchangeably. And also the doctor did mention it was due to excess calories, which again is the same code, E66.01. So then we go to our tabular, look up E66.01, E66.01, morbid or severe obesity due to excess calories. So that is the correct code for the obesity. Go in our alphabetic index, we're under ulcer, pressure, we're looking for stage 3, stage 1, stage 2, stage 3, heel, L89.6, the little dash, meaning we need more characters, and also that little icon, the black box with the white check mark, we need more characters. So let's look up L89.6 in our tabular. And here we are. Stage 1, Stage 2. We need Stage 3. So let's go to the next page. Okay. Pressure ulcer of the right heel, Stage 3. L89.613. I think that would fulfill our need for more characters. Yep. That's it right there. L89.613. And back in our tabular, body mass index 40 or greater, Z68.42 is BMI in the range of 45 to 49.9. So that is the correct code right there. All right, that's all I'm going to show you for Chapter 7. Please work through those exercises. You do not submit the exercises from the handbook.